We're excited to have Dr. Marion Walker join us today for our Ask the Expert blog series. And Dr. Walker is recently retired from Primary Children's Hospital in Salt Lake City, Utah, as well as the University of Utah, and he is the chair of our Medical Advisory Board. Also with us today is Jennifer Bouchard Johnson, who is the Education Manager for the Hydrocephalus Association, and myself, Amanda Garzon, Director of Communications and Marketing. So today we're going to actually field a question from a gentleman named Jamie. And Jamie is asking if scar tissue in the abdomen can shift and cause pain. And if so, what can be done to alleviate the pain symptoms, Dr. Walker?
Well, it's a very interesting question, actually. It's uncommon for scar tissue itself to cause pain in the abdomen. Scar tissue can limit the amount of absorptive surface in the abdomen so that the fluid may not absorb as much as it should, but it's usually not painful. Scar tissue at the site of the insertion of the catheter into the abdomen can sometimes be dense, and it can cause sort of a puckering up around the insertion site, and that in of itself can become painful if you're stretching the scar. Mm-hmm. But I think the broader question is what is causing pain in the abdomen, mm-hmm. and is it related to the shunt? And it is true that shunts can cause pain and discomfort in the abdomen. The typical story is it's a type of pain that moves around. So it may be on one side, the next it may be on the other side, it may be down in the pelvis. It moves because the shunt catheter moves and the pain that it's creating is moving. Presumably it's because the patient has become sensitive to the catheter. The other one that's important to realize is that the undersurface of the diaphragm is very pain sensitive. And if you have irritation of the diaphragm, you feel it in your shoulder.
Oh.
So if there's a shunt catheter up under the diaphragm, touching the diaphragm, it can cause pain in the shoulder, and it's pretty miserable pain. And it could be either side. And that pain usually lasts a little while and goes away because, again, the shunt catheter moves. But occasionally the catheter gets sort of stuck in that spot. And the treatment for that is you simply pull it out, put it back in the abdomen so it's in a different place. And that should work. If you have the other pain, the migratory pain, you might need to change the type of catheter because they're presumably somewhat allergic to the one that's there. And in really unusual cases, I've had to move the catheter to the heart just so there's nothing in the abdominal cavity. But it's a pretty uncommon kind of pain.
In terms of how it feels? Or in terms of
the incidence.
The incidence of it.
You can have a lot of reasons for pain in your abdomen, but it is possible that the shunt can be causing that pain.
So Jen, as someone who has had your shunt placed in different areas, VP and VA, have you experienced this type of pain that Dr. Walker is referring to?
I have. I went about 2 years with this excruciating pain throughout my stomach, and it would come and go. And in the beginning, it was very intermittent, and it would start here, it would go here. And then it got to the point where at certain times I couldn't walk, and I started seeing various doctors, and I went to a GI doctor for a while. And then I ended up in the hospital, and they thought it was actually peritonitis, and then they thought it was a shunt infection, and they took the shunt out, like Dr. Walker said, and as soon as I woke up from surgery, the pain was gone. They put the shunt back in because they thought the shunt infection was gone, and the pain was back right away. And so we eventually found out that the pain was related to the shunt, and they moved it to a VA shunt, and I haven't had the pain ever since. So
that's interesting. So it sounds like some patients some individuals with hydrocephalus who are experiencing abdominal pain, especially the shoulder one, might not actually link it to their shunt or their shunt tubing. And it sounds like might actually experience going to multiple different doctors to try and figure out what's going on. Would some of your advice, Dr. Walker, be if you are experiencing pain, like from your neck down to your abdomen, to talk to your neurosurgeon to not rule out that it actually could be shunt tubing related?
Well, there are obviously a lot of reasons to have pain from here down. But if you have pain in the shoulder, you'll know it's miserable pain, and it's probably the shunt.
Interesting.
If you have that migratory pain, that's more diffuse, and the only way to make that diagnosis is to take the shunt out of the abdomen. So the question is, are we at a point that it's worth doing that to see if that's what's really wrong?
Mm-hmm.
So it can be a tough decision sometimes, but often can be the right decision.
Well, I just want to thank Jamie, because what I thought was a simple question actually turned into a really interesting, complex discussion. And I hope that other individuals living with hydrocephalus who may experience some abdominal discomfort or shoulder pain now have a little bit of insight into what some of the causes of that could be, and that it could be related to the shunt and to their hydrocephalus. So I don't believe that this is written in any books. I haven't seen any place where you can find this information.
I don't either.
You can now find it on our website.
Exactly. You can now find it on our website in our video blog, Ask the Expert with Dr. Marion Walker. So thank you, Dr. Walker, for joining us today.
It's my pleasure.
Jamie, thank you for your question, and we look forward to answering more questions.